Welcome, everyone, to our monthly seminar on religion, spirituality, and health. And today, we've got Dr. Ben Doolittle. Now, Dr. Ben Doolittle has been a great friend of mine for about a decade here, and we've done a lot of work together. And I'm just thrilled to be able to introduce him to you so that you all can get to know him also. So Dr. Doolittle is professor of internal medicine and pediatrics at Yale University Medical School and is professor of religion and health at Yale Divinity School. He directs Yale's combined internal medicine pediatrics residency program, the Medicine-Pediatrics Continuity Practice, and the program for medicine, spirituality, and religion. He is doing so much. He has so much energy. His research interests explore the intersection of medicine and spirituality, wellness, and turnout. Ben is also an ordained minister and serves a local urban congregation. And his greatest claim to fame is that he is a student of mine. So there.
Right. My greatest claim to fame. I know. Hello, everybody. Thanks for spending lunch as you zoom in from Brazil and, hospital workrooms and your offices. And I hope some of you are eating your lunch. And so thanks for eating your lunch together, and let's spend some good time together. Can you see that screen? All right. So the topic today is Beyond Well-Being, Sartre, Aristotle, and the Blue Zones. And that is a photo of Crete in Greece that will come up in one of our upcoming questions. And so I hope to talk only for 30 or 40 minutes so that we can have conversation. I find with these Zoom formats, if you do too many slides, everyone just falls asleep. So I want to stop at like maybe even 12:30, 12:40, somewhere in there, so we can have conversation. Okay. So these are my people. So I am a medicine pediatrics residency program director, physician, and this was taken at our orientation picnic in the before times, and by that I mean pre-COVID. And so I'm a medical educator, and that's how and I'm a pastor too. But I became interested in physician burnout and well-being really through the lens of being a program director. How do we encourage these good-hearted, hardworking, beautiful-souled people to get through this process and to flourish in residency and then beyond residency? And then look at this guy. Look at that guy. So the dapper middle-aged fellow on the left once looked like that. So that's a picture of me when I started in the ministry. And so as I'm a full-on white-coated physician on the wards in the clinics and all that stuff. And as the good brother Harold shared, I'm an ordained minister, and I have the shirt with the little collar, and suffer flares of agnosticism on Saturday night when I'm trying to figure out the sermon the next morning. And so I really feel comfortable walking both sides of the aisle, and a lot of times they intersect. Okay, so here's the objective. Evaluate the present state of physician burnout and thriving, consider perspectives of the human condition from Sartre, Aristotle, and the Blue Zones. And this is really because I appreciate a philosophic model as it informs the evidence. We in medicine, we love being, what's the data show? What's the data show? Well, there are these other models that help inform that. And then I invite us to reflect upon our own, personal model for human thriving. All right, let's take a poll. What is the prevalence of burnout among healthcare providers? And I'm gonna stop the share, and I'm gonna go to my thing here. And you'll see in a second. Okay, boom, 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 boom. Sorry about this. Okay. Do you guys see that? You see that? Okay. Now, if you type in pollev.com/wisdom, you will get that question. pollev.com/wisdom, that website at the top. And you're going to get this question, and I invite you to answer the question. What is the prevalence of burnout among healthcare providers? Okay, good. I know it takes a little while to start playing here, but you can, and Harold, you see the columns going up and down there?
Yes, I can. And they go to their browser, right? They go to the
you go to your browser or your phone. Yep, you just put that in there. And thanks for playing, everybody. We're just checking the temperature of the room here. Oh, I'm so glad that this is, and you see the bars, right, Harold?
Yes, yes.
Oh man, this is so cool. All right. Okay, we'll give it another 5 seconds. And then we're going to go back to the new share. Look at this technology where people are voting from Brazil, from across the country. So it looks like maybe 2/3 say it's between 45 and 55%, and maybe 1/3 say it's 80 to 90%. All right. And then let's go back there. All right. So boom, boom. Okay. Oh, and then the next one is how often, well, hold on a sec. Yeah. All right. And then how often do you feel burned out from work? Okay. So now I'm going to go back. I'm going to do the new share. I'm going to go back over here. How often do you feel burned out from work? Boom. Every day, a few times a week, once a week, a few times a month, a few times a year or less, and never. Thank you for playing. Oh my goodness, this is so great. And you guys see the columns, right? Because sometimes I've done this and they don't see the columns. All right. Okay. Great. Now, this question, how often do you feel burned out from work, is one of the validated questions that correlates to the 22-item Maslach burnout inventory. So whenever you see a big study on burnout, this is the question. The other question is, how often do you feel callous in your work? That's the second question. So those two questions correlate to the Maslach burnout inventory. And the cutoff is once a week or more. So just doing a biopsy of this gang, and you got to fill out the second question, but it looks like, I don't know, what's 19 plus 16? So 35% would meet criteria for burnout. 38% meet criteria for burnout. Uh-oh, some more people are playing. 39%. So like, somewhere around there. All right, new share. So every day, a few times a week or once a week, you would technically meet criteria for burnout. And so here's the thing. Here's my take on this. The prevalence of burnout for the past 20 years has been unchanged. And the answer is between 45 and 55% in general. Now, the folks who answered 85 to 95%, you weren't wrong, because there are lots of populations where those healthcare providers are in that range. So usually it's like emergency department docs tend to have higher degrees of burnout, but better work-life balance. some of the occupational medicine, physical, physiatry folks have lower prevalence of burnout. But in general, it's been about 45 to 55%. And overall, it's been unchanged. So COVID, of course, took a hit, and we might be maybe a little higher, more on the 55% side. Sometimes it'll dip down to like 44%, and we think, oh, hooray. But then the next year it comes back. And we know that burnout has all kinds of downstream effects, like increased medical errors, a lot of job turnover, all kinds of mental health stuff, depression, poor marriage, all that kind of stuff. And I've done, there are plenty of articles written about that. Now, the other problem with this burnout research, and I invite you to reflect upon this yourself, is that we don't know really what the prevalence of burnout is. We have a pretty good idea, but the problem is nobody fills out surveys, right? We're burned out from burnout. That at Yale, I get the physician engagement survey, and maybe 25%, 29% of people fill it out. And so we don't know about the other 75% of people who aren't filling out the survey. Do they fill it out? Do they not fill it out because they're too burned out? I don't know. So we're burned out from burnout. We know it's a big deal. We know it's really prevalent. We know there's a lot of downstream effects. And some of the problem with burnout is initially 20 years ago, 15 years ago, we were talking about mindfulness and resilience. So I'd go to the residency program director meetings, and there'd be a workshop on how to build resilience with your residents. And then we thought, or like a mindfulness class, right? Who wants to go to a mindfulness class at 7 p.m. on a Thursday, right? Oh my goodness. So we realized that maybe burnout is an appropriate response to a toxic situation, right? And that the problem might be these systemic problems. So there are intrinsic stuff, like the stuff that's within me, my resilience and my spiritual architecture. And then there's the extrinsic stuff, the electronic medical record. What kind of leadership do you have? What's the work culture like? The power of friendship as a supporting aspect for burnout and well-being. And then the other tough thing is that interventions. There'll be an intervention trial, family dinners, an app that does gratitude. And usually they're very, very short. There aren't really longitudinal data on these. And the interventions have been pretty modest so far. So what do? We do interventions. We don't really know. We don't know the prevalence of burnout. And then, and so during COVID, I got reading the Existentialists. Now, just a word of warning, the next time we're all in quarantine, we should probably read something happier than the Existentialists. This is a painting by Edward Hopper called Sunrise. And whenever I look at this painting, I see in the painting my own disposition. So sometimes I look at this painting and I think, what a hopeful day, right? The sun is rising. She's looking with anticipation on the new day. But during the pandemic, when I discovered this painting, I thought it was forlorn and sad. Here's this woman in isolation, in quarantine, with this note of despair. The sun is rising outside, and we are trapped in our box at home. And to give folks a recap on existentialism, so that's Jean-Paul Sartre and Simone de Beauvoir, and they were the leaders of the existentialist movement. There they are, frolicking on the beach in the south of France. And existentialism grew out of this, the nihilism of World War II. So Europe was destroyed. The philosophers started gathering together to articulate what was the spirit of the times, and came up with this idea that to exist means to exercise your choice, your freedom. And what does it mean to be an authentic person? And the way Sartre and de Beauvoir landed is that to exist is to be in a state of anxiety. And I just read some quotes there. It is certain that we cannot escape anguish, for we are anguish. Nothingness lies coiled at the heart of being like a worm. I exist, that is all, and I find it nauseating. And then, of course, there's the famous line, hell is other people, from his play, No Exit. And then, of course, you guys have all heard of the existential crisis. The thing about the existential crisis is that it maps very, very well with the burnout syndrome. So burnout has come out of the realm of psychology, social psychology, right? And it's a work-related phenomenon. But then, meanwhile, this whole time was this idea of the existential crisis, whereas this dissonance between identity and your perceived reality. So an example of that is like, hey, I'm a physician, right? I see my identity is to be at the bedside of a patient, giving counsel, being an instrument of healing. So why am I sitting in front of the computer 80% of my day, trying to get my notes done and the billing and the coding correct? It's that gap, right, between who I see myself as and what my reality is. And it leads to all of this stuff, right? The anxiety that Sartre and de Beauvoir talk about, this loss of meaning, and then this idea of wanting to withdraw. In the burnout world, they call it disengagement, right? You uncouple yourself from the mission of caring for that patient. So, good friends, as we emerge from this pandemic, are we in a state of existential crisis? Does the nihilism of World War II somehow also reflect our own spirit? In many ways, yes, perhaps. So I put the question to myself, is anyone happy? And as a physician, I'll speak from that place. Is any physician happy? And why are they happy? So, all right, everybody, what's the happiest country? I'm going to do a new screen share here. What's the happiest country? Boom, boom. What's the happiest country? And if you go back to that poll, there we go, Finland, United States of America, Costa Rica, Greece. Let's see, is everyone saying Finland? Greece is there, Costa Rica. Nobody's saying the United States. All right. All righty, we got Finland is leading the charge here, the happiest country among those four. Finland, United States of America, Costa Rica, Greece. We'll give it another 10 seconds here. Okay. All right, looks like everyone's okay, a little bit of looks like Finland's taking the lead here. With a little bit of Costa Rica and a little bit of Greece. All right, we will go back. So you guys are right. The gathered corporate wisdom of the group has gotten the right answer, that it is, that of those four, it is Finland. It is Finland. And I got interested in this. So I got interested in this as I was looking for a model of well-being. And so there's a journalist, Dan Buttner, who developed this idea of the blue zones of longevity. You guys familiar with that? The blue zones of longevity are those parts of the world where people live to 100. And as he continued that research, he expanded the idea not just of longevity, but also quality. And so where are the parts of the world where people live long, but also are the happiest? And so Finland is right at the top. because Finland has a strong sense of social community. So the government funds your maternity leave and paternal leave, your education, your health care. The taxation structure is high, but that means, but then everything else is cared for, your pension and all that. So then when you're trying to figure out what to do with your life, well, you might want to do something that's highly remunerative, but then you're going to be taxed. So you might as well do something that you would really love to do. So people in that society have a high degree of purpose because they're doing the things they want to do. There's strong communal bonds, and there's good physical health and community, and people have enough. So these are the 5 domains that the blue zones of happiness evolve to. Now, Greece is really high on that happiness index, but they tend to be a little lower because of their economy. Now, Costa Rica is always in that top 15, and Costa Rica is a very interesting country because it's a developing country, not quite a developing, it's a second world country, I think. I don't think we use that phrase anymore, first world, third world. But anyway, they've invested even though their economy is small, they invested in education. So the literacy rate is 90%. They've invested it in healthcare. People have good diets, they move, and they have good access to primary care. And they have strong communal bonds. And so Costa Rica is a mountainous country. And so instead of having the large plantations that were owned by, the conquering Spaniards, it was smaller farms in the mountains, and people had to rely on each other. So they developed these strong communal bonds, no standing army, investing the money in social programs. And they're also, I think they're like a 0% emissions. We went down there as a family, and there's like wind farms all over the place. So that on the right is that pentagram there, and that's actually the pentagram for Costa Rica. And you can see the finance is a little low, but the others are pretty high. So, and so I had this idea that we could ask happy people. Now, let me just check the chat. I can't see your face. How do you define burnout? Oh, people voted Denmark. Bhutan. Oh, Bhutan is interesting. So Bhutan is thought to be, the world's happiest country, but there's actually a sizable minority that is oppressed in that country, which we don't really talk about. And then that World Happiness Report that Syed put in. So these 5 domains of the blue zones are now incorporated into the World Happiness Report. The World Happiness Report does other stuff too, like crime indices and things like that. But these 5 domains are now incorporated in that. Let's see. And then how do you define burnout? Thank you very much. I should have looked at that. Oh, Dan Hall is here. Okay. Anyway, so yeah, how do you define burnout? Good question. So it's 3 things. It's that feeling of emotional exhaustion, depersonalization, you treat the other person as an object, and disengagement. So you detach yourself from your mission. And I should have been more clear. All right. So let's ask happy people, and in particular, happy physicians. All right. So we've interviewed 183 people so far with various teams. So we've done 32 primary care physicians. We've done 23 emergency department physicians. We did a project among residents who were in the Medicine-Peds and Med-Peds programs. And then I got interested in people who are in wheelchairs, who, had spinal cord injuries. And so, we physicians might kvetch about how we're so burned out and exhausted and all that. And I thought, gosh, maybe we should ask people who are, living in wheelchairs, and maybe they could teach us something. And then there's this wonderful project among palliative care chaplains and physicians, and then just started partnering with sociologists in Pakistan. We're looking at Pakistani physicians, and the idea is we do two questions. How often you feel burned out from work, and how often do you feel you've become more callous to people since you took your job? So the idea is, to be in this study, you could not be burned out. You could not be burned out, but that does not mean that you're happy. So there are two other questions. How satisfied are you with your life, and how satisfied are you with your career? And you have to be a 7 or above to be included in that study, in our study. So you couldn't be burned out, but you also had to be thriving. So it was those two hoops, if you will, to be included in our study. And let's play the game. So one of the questions was, how satisfied are you with your life? And let's go with, let's just ask everybody how satisfied they are with their life. So how satisfied are you with your life? So if you go back to that poll everywhere on your phone or the browser, and okay, a lot of 7s or 8s, a 4, a 7. And oh, this is all anonymous, by the way. We're just checking the temperature of the room here. And thanks for playing. It's fun, right? We're having lunch. We're doing these polls here, like in the magazines there. All right. So if you looks like most of the gang here are pretty satisfied with their life. If the 7 correlates well with the satisfaction with life index, which is a 7-question multi-item validated instrument. And then this question correlates well with that. So we use 7 as our cutoff. And so you couldn't be burned out. But you had to have some degree of thriving. So some degree of thriving. And then this was the model we came up with. So we did the whole qualitative studies. We did all these interviews. We recorded them. We transcribed them. And we did thematic analysis, grounded theory, iterative thematic analysis. And so these physicians, this is our model. And that's been stable over the different populations. The Pakistani physicians were still crunching the data on that, and the folks in the wheelchairs living in, with spinal cord injuries, their model's a little bit different, but it maps pretty closely to this. So I'll start at around 8 o'clock there with connections with patient, and 10 o'clock love for the work. The physicians that we interviewed who were not burned out and who were thriving, they described fundamentally what they enjoyed the most was being connected to patients. They would say things like, quote, "I love being in the room with my patient," end quote. That they loved medicine. One of the residents went on this long monologue about hyponatremia with enthusiasm, low sodium. So these docs over and over would say that they loved their patients, and they loved the practice of medicine. Now, grounded and connected is a big one. And this was a very loud signal over and over and over among all these populations. So these physicians who were thriving would describe their work environment, the connections with people, quote, "They're like a family," end quote. Quote, "We've been working together for years and years, and I really care about them," end quote. But it's not just at the work. It's the interconnectedness of life, of rich connections outside. So one person said, I was raised Catholic and I'd married a Jewish lady. So every weekend is a bar mitzvah, wedding, baptism, confirmation. I'm busy with all these family things. But then someone who described themselves as an introvert said, I have 3 good friends. I rely on them. We go on vacations together, so it's not just quantity, it's quality of these interconnected relationships. One doc said to me, "Oh, this is a great interview, but I got to go. I'm in a bicycle club and my guys meet, at 4:00, so I got to be there." So grounded and connected, folks spoke very warmly about their social network. And then value-oriented beliefs. So these are folks who are not doing medicine for the money or the prestige. Again, the first was among primary care doctors. I'll just put that out there. But it was true among the residents and the ER docs, that people are doing this out of a sense of vocation, a sense of call, a sense of justice, a mission to heal. And that really was central to their sense of identity. And they express that in very warm words. My job is to be a healer in this world, fundamentally. One of the docs talked about being on the board of a summer camp for kids. And I asked her, I said, "What are you doing on that camp? What are you doing on the board of that camp? Are you the camp physician?" She said, "No, I'm not the camp physician." I said, "Well, are your kids? Do your kids go to that camp?" No, my kids, no, they never went to the camp." "Well, what are you doing on the board of this camp?" And she said, "Well, my mission in the world is to care for children. And so being on the board is part of my mission." So value-oriented beliefs. Now, agency in the workplace. This is fascinating, you guys. So the physicians described how they had some degree of autonomy in what they could do in their job. So these are folks who were not slamming out, 9 half-day clinic sessions a week, or, banging out lots of shifts in the ED. These were folks who would say, "Gosh, all right, I work hard, and I'm also working hard. I got the med students in my office. I'm on this committee at the hospital on quality and patient safety. I serve on this, state board of something or other." These were busy folks doing the things that they felt were necessary to do, both professionally and personally. Interestingly, I asked very explicitly about work-life balance, right? Work-life balance, the buzz of having a balanced life. I got a lot of puzzled looks about that. This idea of work-life balance. They said, "Gosh, I don't know if I have work-life balance." They looked with a quizzical look off into the distance. Not sure if I have a good work-life balance. Instead, I think it was a plunging forward type experience with these good folks. But again, meaningful work. Now, the residents, they did not have agency in the workplace, our resident project. And so the residents would describe, instead of agency, they described supportive leadership. Now, again, this was blinded. I'm a program director. I did not do the interviews for the residents. And I could imagine some residents saying, "Oh, I don't have supportive leadership and I am burned out." So it's not whether we're supportive or not, it's just the perception. The residents who perceived that their leadership was supportive, they tended not to be, they were thriving, and they realized that supportive leadership was a big deal. Okay, so I'm pondering all of this model and the blue zones and the existentialist crisis and on this. And I remember from my college philosophy classes, this idea of eudaimonia, of flourishing. And so the photo, the painting there is from Aristotle, is of Aristotle from Raphael's School of Athens. You guys know that. It's the painting from that hangs in the papal apartments. And Aristotle is putting his hand out because what is real is what you can see and feel and touch. And they say that Aristotle was the father of science, you know. And so eudaimonia, the EU in Greek means well or good, and daimonia means spiritedness or blessedness. So this concept of eudaimonia, Aristotle wrote a fair bit about in his Nichomachean Ethics. That's the book he's holding, by the way, his Ethics. And so Aristotle, his method is to create polemics. So on the one hand, people say this, on the other hand, people say this, and the truth is probably right in the middle. So what he says is those Stoics, you know, they use their logic to discern virtue. And so life should be about doing good works, being virtuous, you know, fulfilling the telos of virtue. And then, you know, the Stoics look across down the hall and they see the Epicureans and the hedonists, and for them, the point of life is to, you know, pleasure. Eat, drink now, because forever, tomorrow you might die, and it's all going to end, so you might as well pursue pleasure. And Aristotle recognizes that, gosh, if you go clubbing every night, it gets just kind of old, right? But if you maintain virtue all the time, it doesn't feel so good. And so his point of eudaimonia is that your life should feel good. You should have this feeling of satisfaction. And then also there should be elements of virtue. You should also do good. So it's interesting how these 5 domains that we found through grounded theory and these qualitative studies land pretty well in this Greek concept of eudaimonia. So I'm going to stop here. I'm going to ask, look at that guy. He put himself in Raphael's School of Athens, right in the middle between Plato and Aristotle. Look at that. Anyway, so look at that. It's 12:37, just in a nick of time. So I invite folks to give thoughts and comments and all of that. I'll start with the chat. Let's see. Chaplain Lori Jacobs, thanks for writing in the chat there. I'm of the opinion that work-life balance should read work-life, home-life balance. Work is still life. Yeah, I think you're right. And it gives me pause to say, how do I make my life at work better? It deserves my creative tension. Yeah, that's a really thoughtful idea, right? And somehow that work-life balance, it makes it sound like life is what you're trying to do, but oh, by the way, there's this work that's not your life. But clearly we spend so much of our waking hours doing work. It'd be nice if it was like meaningful and enriching. Beth Hudnall-Stam developed the ProQual, an alternative to the Maslach, which includes related but different concepts. Her research finds that burnout is counterbalanced by compassion satisfaction. Yeah, that's true. This supports your thesis that even high stress work can be sustained if it has purpose and meaning. Yeah, the ProQual is that's a good index. And I used that for one of my, a survey study that I did. That it's, what was it? It was 3 domains. So it was burnout, and the ProQual burnout index maps pretty closely to the Maslach, but not completely. So it's interesting to like, it's hard to use the ProQual burnout and compare it to some of the Maslach burnout studies because the questions are a little bit the same. Compassion satisfaction. And I think the 3rd domain was like trauma or compassion fatigue. You know, that feeling, you're traumatized as a healthcare provider because you're around so much suffering. So that's a pretty interesting instrument, and it probably should be used more. So that's a good pitch for the ProQual.
So Dr. Doolittle, tremendous talk. And this is very exciting that we have time to be able to talk more with you about this subject. So I would encourage participants here to unmute yourself and ask your question to Dr. Doolittle.
Yeah, imagine that, a talk that doesn't end with 5 minutes left. Like, so yeah, so you can unmute yourself and ask a question. Please do so. Yeah. Or I'm just gonna talk more.
So I'm a chaplain at a VA, and where would you say chaplains' roles fit into physician burnout?
Oh, yeah. Good question. So I find, first of all, I think that the chaplains, at least in my hospital, they are busy and there aren't enough of them. And I feel like the return on investment, I'm trying to think like, how do we justify chaplains to the CFO? I think we could probably triple the number of chaplains in the hospital and we probably still wouldn't have enough. And I think that chaplains, I've actually wanted to study this and do like a systematic review on how chaplains actually improve hard outcomes in the hospital. I know this isn't directly answering your question, but I will. But this is something I really, really think is important because chaplains, I think, are underfunded and there aren't enough of them because the people who write the checks don't realize that there's such a benefit to having chaplains in the hospital. So there have been a few studies where if a chaplain visits someone who had a hip replacement, that patient doesn't use the same amount of pain meds and calls the nurse less frequently. That's huge, right? They don't use as much narcotic and they call the nurse less frequently after a chaplain visit. There have been a lot of chaplaincy studies are around, adjustment to illness and fear of death and anxiety and things like that. So those are important subjects. But I like there was another study that said chaplaincy helped reduce the length of stay. It's a very small study. But I think we need more studies like that to show hard outcomes. Oh, Press-Ganey scores, patient satisfaction. Patients who've been visited by chaplains, they like their hospital stay better. And that's money, right? So I think we need better research to justify chaplains so we can hire more chaplains. Now, to get directly to your question, this idea of chaplains, one chaplain said to me that the staff are your regular congregants and the patients are the visitors. I love that metaphor, right? So the idea of if you're the pastor of a church, there's the regular people who come to church all the time and they're always there. And then you got the visitors. And so in a hospital, the staff are the folks who are the nurses on the day shift and the nurses on the night shift and the residents and all this. That's the congregation and the patients are the visitors. Now, I think the inner life of healthcare providers is very rich. Notice I'm not using spiritual life or religious life. I like the word inner life because it hasn't been appropriated by, these other camps. So the inner life of people who work with the sick, nurses, techs, docs, PAs and such. We are at the bedside of suffering as a daily practice. And our encounter with death and doubt, anxiety, it's what we do all the time. And so how do we process that? Well, I think a rich inner practice, prayer, meditation, community, religious life is really, really important. But to become a high-powered, highly educated physician, nurse, PA, nurse practitioner, we've used our left brain, and we have this model that's more logic oriented or postmodern or whatever. So I think many times in healthcare, we need a language, we need a model, we need a path to help us with our inner life. And that's where I think a chaplain in a hospital can be really, really helpful, because a chaplain is also at the bedside contending with anxiety and doubt. And I just wish the chaplains, there were more chaplains to be more present to the folks who are also struggling in the hospital and in our clinics. And that's the folks who work there. So that's a great, great question. And I really think there's a big horizon there that could be helpful. Anyway, what's this? George said, my colleagues and I are in Transforming Chaplaincy are wrapping up a scoping review of the benefit of spiritual care for resilience and stress. Stay tuned. Hey, there we go. All right. Thanks, George. Any other questions or comments at all?
Yeah, Dr. Doolittle, I just put this is Danny McIntosh. I just put a question in the chat.
All right. Well, speak your question so you can
Okay. You mentioned that that interventions have generally not been well studied or successful or long term. And you also mentioned that many of the issues are about a toxic environment or they're more systemic. So I'm wondering how we kind of put those together and think through what types of maybe systems level interventions or other types of interventions might be helpful. What should we be exploring?
Yeah, that's a great question, because I don't know, the way one way I think about this is it's not just in like the well-being, flourishing, burnout space, but it's about these interventions in general, which is if there is a flood coming in and you have to build a wall, you can't study what the difference one brick makes, right? Like you can study, I don't know, we're just finished up a study on a pilot on family dinners. I really think family dinners are a big deal. So we basically had residents write down 3 good things every day, and then they had 2 family dinners. And we're going to we did a follow-up, a survey at the end, and then we did a 1-month follow-up. And it showed like everybody wants to have more family dinners. Like everybody gave top marks. They thought it was great. And we just went, the gang went to a falafel restaurant. It was cheap. And so, but it didn't really change burnout that much. It didn't change a sense of well-being. It had this like lift that people really appreciated it. But, how does falafel with your friends once a week, twice, over 2 times, how does that stem the tide of working 80 hours a week in the MICU? I don't know if it does, right? But family dinner plus a supportive work environment plus a good mentor plus some kind of inner life, like a bunch of things kind of adds up, right? Like that model that we developed, right? It wasn't any one thing. It was like the whole package. So that's the tough thing with interventions, right? I don't, an intervention probably needs to be a multimodal intervention. And then of course there's no, like the long-term follow-up. It'd be great to track people over a year or 2 years or 3 years. And that's just hard to do. They always say the best time to plant a tree is 40 years ago and the next best time is today. So I keep thinking, oh, I got to do that. Like everyone gets their code, their initials and their birth date. And then you could send out surveys. I've been on the faculty for 21 years. Like if I started this 21 years ago, I'd have all this great data. All right. That was a wandering, answer. How do you deal with administrators I don't know, Dorothy, do you want to talk more about that?
Yes, I would, because I really don't know what to do. I'm a social worker and also a mentor doctoral students. And I've been with a corporation for many years. And the corporation was sold. And the new folks come in and they're doing a lot of good things. And they're talking about establishing a community of care. And at the same time, faculty, contributing faculty and part-time faculty haven't had pay raises in 20 plus years. That's one part of it. And the part that most people, the teachers love, is working with the students and sharing their creative works with the students. Well, then suddenly this corporation sends out this document that either you sign it or you're fired. That type of document, we own you and all your creative works. And I have no problem with signing whatever course development and thing belongs to the corporation. That's no problem. But it's how people are being treated in even this one document. Whatever positive things have happened, all of a sudden, many of the staff are feeling like more than burnout. It's hard to explain. How do you get around that and do something that's very positive?
Well, Dorothy, that is a great question. And I think what's so poignant about your question is that you describe like your particular setting and then this particular thing that happened with this letter you got to sign. And the thing that's so important about that question is everybody on this Zoom probably has something similar, right? It was a policy that was implemented, or the webinar training that you have to do on your own time, or the pay isn't commensurate with others in the same field, like a million reasons. And I wish I had a great answer because I think my own success with administrators has been moderate. So anything I have to say is I'm not an expert. I'd have to say that I would love for our leaders and our healthcare workers, physicians, residents, and as what I do, residency education. I think we emphasize the resume virtues and we do not emphasize enough the eulogy virtues. So the resume virtues are what goes on your resume, right? Your publications and your MBA and your academic rank and all this kind of stuff. And we brag about that, right? Like I'm a residency program director and I rank, I get residents and I brag about, how we do on the rank and what the med schools they came from are.
Yeah.
But over the years, I've emphasized more the eulogy virtues, kindness, people who genuinely like people, people who seem to go the extra mile. So in my own residency program, I really like people who've had a job, not research internship, but like an actual job that's forward facing with like people, and in particular teachers. So folks who did like Teach for America, every time someone did Teach for America and they come to the my residency program, they're always amazing. So I'd like to think that in the space of like choosing our leaders, who are the people who are going to shape the culture, I'd love it if we could emphasize the eulogy virtues more and maybe de-emphasize the resume virtues a little less. I don't know. Is that, anyone have any other thoughts on that? I don't think that was a
I
great.
wrote a poem. I wrote a poem like that and I sent it to my boss.
Oh, good. I'm sure your boss loved it. You're the toxic environment inspired poetry. Maybe that's not a bad thing. Let's see. Someone, Larry Burke.
Yeah. Hey, Ben. I enjoyed the talk. I've always enjoyed Harold's seminars over the years. I retired from Duke a year and a half ago, and after 45 years in the system. And I just submitted a question in the chat, which was, could the way we deal with the symptom of burnout without getting to the toxic environmental root cause be a metaphor for the systemic problem of how we deal with physical symptoms using a biopharmaceutical model without getting to the toxic root cause of illness? So we're in this system that causes us to think biopharmaceutically and not environmentally, and that's kind of what we're having to do with burnout. Is it's a symptom, we're dealing with it, but the root cause is that we're trapped in this model that doesn't support a healthy life, you know.
Yeah. Yeah, you're probably right about that. And which makes me wonder, like Finland, that's why I was so attracted to that idea of like, how do we make a workroom in a hospital more like Finland? You know, and it probably, part of it is, you know, the work is hard, right? There's just so much to do. And so that's hard. I think having good people in that room is super important. And that's something we can do like today or tomorrow, right? Get the right people in the room to shape culture. Because the work is hard. Like the suffering isn't going to go away from people.
Hey, I think that the one thing that's overlooked in our biopharmaceutical model is the meaning in symptoms, the meaning in illness, and that's just. I remember in medical school 45 years ago, that's what I was interested in, but it turned out that that's not what they weren't going to teach me anything about that. I come about that 40 years later and become a health coach, you know, and
wow, cool.
And so and I went into radiology to escape the toxic environment in the hospital. So ironically, yeah.
Wow. So radiologist to health coach, but you made it 45 years. Congratulations.
And I'm still doing the health coaching because it's fun.
There it is. Wow. Great.
That's why my burnout score is 0 at the moment. So.
Oh. Wow. We all want to be 45 years in and still happy doing what we're doing. Any other questions or thoughts there?
So just one comment. I'm not sure if you can hear me or not, but ironically, I heard something about Finland on a radio talk show this morning, and they're offering a quote master class of happiness in Finland.
Wow, really?
Yeah, if you go to if you Google it and you go to CNBC, I think it came out maybe a few days ago. Finland, #1 happiest country in the world, is offering a free master class of happiness. Here's how to apply. Just FYI.
Yeah, there you go. Wow, I think I found it actually.
Thank you so much, Dr. Doolittle. I was wondering about this slow quitting process and how that plays into this. Because for me, when I think about slow quitting, I see it as detachment. And so I was wondering, how does that all play in?
Ooh. Yeah. Boy, that's a really good question. Because you're right. That is that domain of disengagement in burnout. That is that. Slow quitting is that. I got to think more about that. Because it's really popped up maybe in the last year, hasn't it? It just seems like to be more in like the Apple news feeds and on the, this idea of slow quitting.
And there's whole communities of people who are encouraging other people to participate in that process of slow quitting. And part of it is they are achieving their dreams, and they're putting their dreams kind of like at the forefront, but they know they have to work. And so it's just something that they do. So it's not it's not part of their vocation. It's kind of like they realize the system is the system and they got to get out somehow.
Yeah. Yeah, that's a really good, we're going to be hearing more about that for sure. It sounds kind of sad to me, right? Like you're going to spend 8, 9, 10 hours a day doing something that you're slowly quitting from. That seems kind of sad. And it also makes me a little worried about, how do we care for sick people if everyone is slowly quitting? So I don't know, maybe to be continued. Dr. Koenig, it's 101.
It's 101, Dr. Doolittle, and thank you so much for a tremendous presentation, and thank all of you for all of these great questions that have brought up so many interesting thoughts and issues. So thank you all, and thank you, Dr. Doolittle, and God bless, stay safe, and we'll see you next month.
Over and out, everybody. Thanks.